Welcome to Now Innovating, a research to impact series at the University of Calgary. I'm your host, Julia McGregor. May includes both National Nursing Week and Canadian Innovation Week. And my guest this episode, Dr. Sandra Davidson, Dean of the Faculty of Nursing, is a champion in both nursing and innovation. In her role as Dean, Davidson is helping to nurture future nursing leaders in entrepreneurial thinking and social innovation to apply research into clinical practice. As a registered nurse, professor, and creative innovator, she understands the important role Canadian nurses play in innovating for good. In the first of this two-part episode, I speak with Sandra about the role of innovation in the culture and the practice of nursing. Hi, Sandra, and welcome to Now Innovating.
Thanks for having me.
I'm so excited to have you here. I first just want to set the context because you've had several leadership positions in Alberta. You've had a position in the States.
Yes.
I wonder if you could just speak to the differences in the culture of innovation between Canada and the United States.
Sure, and that I'll start with a more common question that I get is what's the difference between nursing in the United States and Canada? And I would say at the front line, at where care happens, we have more similarities than differences. We think that it's going to be totally different because the systems are differently funded and all those kinds of things. But in the day-to-day work of nursing, we have more common challenges than you would think.
Okay.
And I think that's very important to think about in healthcare innovation because sometimes we're reticent to, have an idea or an innovation that came from another country. And oh my goodness, how's that going to work in the Canadian context? And more often than not, what I see is there's more transferability than you would assume. I think in terms of the innovation landscape, it is different. At the time I lived in the US for 8 years and worked in for-profit education, state universities, for-profit healthcare, which was really weird from being Canadian. And that just, it's not been our experience.
Yeah.
But there is that whole kind of individualistic mentality, anyone can live their dream and private enterprise is kind of king and kind of a profit-driven model. And that is definitely more prevalent in the US. And I think that naturally is a good segue to, innovation and entrepreneurship. It's kind of more baked in from a societal level and socialized as kind of a good thing, I'll say. It's not always good. And the Canadian context, we do have this strength in that we have, access to healthcare, and that's not a privilege; it's a right in the Canadian context in the society. But I find sometimes that is a deterrent to innovation, and people automatically go to, it's going to be for profit. We're going to have a different payer system, and no, that's bad. And there's this knee-jerk reaction that kind of gets us away from the capacity and value that innovation can add in a Canadian context. So I think some of the work that we're doing around broadening the understanding of innovation beyond, it's a new thing, it's a new technology, it's something that's commercializable, and getting to this idea of social innovation that I know we'll talk about a little bit later. But innovation really in itself, if we think about it in its widest context where it adds value, it solves a problem. It makes lives easier. There's tons of room for that in our system. And I would say in the Canadian system, looking at Alberta, for instance, we have one provincial Alberta healthcare system. Talk about the capacity for scale and spread because you're not fragmenting, right? So I think we just we look at it differently. We have different opportunities.
Thank you so much for setting the stage for that. I think that's really important for, as we continue this conversation. And thank you also for, answering about the difference between nursing culture too, because I wasn't sure if I should ask that, but I really appreciate you addressing that.
I get that all the time.
Yeah, it's good to know. So, continuing talking about culture. So at the University of Calgary, we're really building this culture of entrepreneurial thinking and innovation. And we have this big Innovation U Calgary ecosystem to help support that. And social innovation, as you said, so there's the Social Innovation Initiative, which is led by Nursing Zone, Dr. Karen Benzies.
Yes.
So I'm curious, how you think a culture of entrepreneurial thinking and innovation can be applied to the practice of nursing.
It's always been there.
Yeah.
We just call it different things. And I think that's the big, in my, 25, 27 year journey as a nurse and a lot of that has been as a I will say a serial innovator in many different ways. Part of it is the languaging. Inherent, nursing is a people-based profession. We are in the business of helping people to thrive and be healthy. And I love the phrase greater human flourishment, right? And so that is very akin to a lot of the principles of innovation, right? In terms of solving the problem, decreasing barriers, increasing access, increasing quality of life through doing things differently and adding value. And that's what nurses do on a day-to-day basis, but they don't call it that. And so they don't, I would say by and large, nurses don't identify what they do as innovation, but when you get down to it, it actually is. And I point to, there's a lot of literature and in the healthcare literature about nursing workarounds. And basically nursing workarounds are what happens when a nurse or a group of nurses come up against a system barrier that isn't working for them, or it increases the time it takes them to do something when they're trying to do the very important work of saving someone's life or making sure they get the care they need in a timely manner. Sometimes it takes a long time to change systems. And so nurses come up with these creative ways to work around to get the very pragmatic work of caring for people done. And that is innovation in and of itself in a system that has sometimes resisted change and innovation. Yeah. So it's in our DNA as nurses, but we don't call it that. And I think that's the biggest challenge that I find in helping nurses, whether it's students, whether it's colleagues, to see themselves and the potential for innovation in what they do is to put new language to it. Yeah. And I think that getting out of our disciplinary language and understanding the language of other innovators in different fields. So how can a nurse talk about a good idea that he or she has with somebody in biomedical engineering who might have the other piece of the equation, but we're calling it totally different things. So some of it is that breaking the interdisciplinary boundaries of language. And, I'm talking about, reduction in patient wait time or decreased medication errors. And the person who might fund my great idea, who's got a finance background, is calling that return on investment, right? So the more we can understand each other and talk together and cross-pollinate, the greater the opportunity there is for innovation. And I would say the other thing is the next step for nursing colleagues, and what we're trying to do here at U Calgary and our Faculty of Nursing, is really give our nursing colleagues and our students the confidence that nurses belong in innovation spaces. Indeed, they are sorely needed in innovation spaces.
I thought lots of like that frontline insight too that comes from being there. In my previous life, I was with the ward of the 21st century and the medical ward there. Like the nursing staff on that unit were so instrumental in providing feedback on like other innovations that have come in to see, is this even feasible to practice? Like, does this even work? Is this going to interfere with my patient care and flow? So like I think that's so important too. Like almost that self-reflection of nurses realizing that you are innovating. You're all the time. You're integral to this process of healthcare innovation.
And we are we are the profession that is in healthcare 24/7. We see those that we care for, whether it's in a hospital or in the community. We have the closest ties to them in an ongoing sort of way, not this episodic in and out. And so much of innovation from that systems level is, the sustainability of innovation is really key, and nurses see that front and center, versus if you're in an episodic kind of relationship, you may say, that worked for 5 minutes. That's great. So I think there's a lot of perspectives that, innovations writ large, whether we're talking about a new device or a new process flow, that lens of nursing, which is the steady state and most closely aligned. The other thing I would like to say is that nurses have such a close relationship to those we care for, our families, our patients, our community partners. And a lot of the DNA of nursing is really that advocacy for, patients and families who may be reticent to say something at a systems level or on a feedback form. They will probably say it to a nurse, or the nurse will experience a frustration that they're seeing that patient and that family have firsthand.
It's so important. Thank you for just talking about that. It's amazing. So I think we've kind of we've kind of gone into this question too, because I want to describe, the current role of nurses in clinical practice and research. But can you how can nurses really become leaders more in this space?
Mm-hmm. And I think part of it is that, just as we said, that confidence and recognizing that, nurses have a lot to offer, and just kind of, inviting yourself to the table is a piece of it. And, I even think about going back to that idea of innovation has always been inherent in nursing. One of the first, I was reflecting on this for the interview, and one of the first times I realized as a new nurse myself that what we're doing is innovation. If you've ever been in a hospital, an acute care hospital, and you've been a patient yourself, and you're, after surgery, you're trying to walk down the hallway, but you have a urinary catheter, and then you have this IV pole that you're having to hang on to, and you either have a nurse who's running one thing and somebody else is hanging on it, and it's a little parade going down the hallway just to get somebody up and walking. And I remember one of my nursing colleagues was so frustrated by this. She basically took a tongue depressor and some tape and taped that to the IV pole so that we could hang the catheter bag on the bottom of the pole so that a patient could actually walk down the hallway by themselves. Well, fast forward, 5-10 years later, now all the IV poles in the hospital have this nice designed little hole that your IV bag or your catheter bag can go into. But it started with a dipstick with tape to a pole. But that's the kind of pragmatic presence that nurses have in the system, that they see the problems, they see the pain points, they MacGyver things.
Yeah, fast prototyping.
Beautiful fast prototyping, whether it's a process, whether it's an actual tangible thing like that, and just elevating that visibility and saying, that's innovation. Right? That is fast prototyping, but a nurse isn't going to tell you that was a fast prototype.
No, you're like, I just solved a problem. I need to get on with my day and provide my care and for my patients. And,
exactly. It's in passing innovation, but it makes a big difference, right? In terms of quality of care. Sorry, we were talking about how can nurses be leaders in this area?
Yeah, how can they do more to be in that space?
Yeah, I think, like you said, inviting themselves to the table, making those I'll say, looking for co-conspirators, people that are also looking to problem solve in the system, but from maybe very different vantage points. You mentioned Ward of the 21st Century. I think is a great opportunity there, but unfortunately, I think then it becomes this, I'm not on W21C, so I don't have a part in that, right? So how do we create that an innovation can be anywhere and everywhere in the system? And instead of saying it has to happen on this unit or in this ecosystem, we want to create those folks that are finding those opportunities for innovation across.
Yeah, or not just at this pitch competition or at this hackathon.
Exactly, and that's great to have those opportunities to raise that visibility and understand, okay, this is what it is. And that's a great start to say, okay, I'm going to go for the Innovation for Health Hackathon and understand how to do this. And what I find is when nurses do those kinds of things, they go, oh, well, this is not magical. We've been doing this all along, but now I have a different language and I have a different constellation of people that I can talk to about this. And when I don't maybe understand, the return on investment piece to make this fly from a financial perspective, I now have people I can reach out to. So it's really just getting embedded in the ecosystem. And representing the unique value that we bring to that. And I would say the amplification of what we can bring. I also think there's the other piece that I find, I've been here at University of Calgary for 5 years, and, we're being an evidence-based profession. We always talk a lot about research and what's the evidence to support this. And I think from a healthcare perspective, evidence, I like to think of evidence as the starting point for innovation, right? So we always have a focus on patient safety and not wanting to do any harm. And I mean, that's a fabulous place. So we're doing things that are based on a solid foundation of that. But then how do we amplify that through streamlining, through innovating, and that sort of thing? All that to say that nursing research is the foundation of what we're doing in innovation. So a perfect example, really simple clinical example. When it comes to research, and people, I think in our faculties and in society think research can be very expensive. If you want research money spent well, give it to a bunch of nurses because we make your dollar go really far. And a lot of the interventions that become innovations that are part of our research and our innovation ecosystem are really inexpensive, right? So for instance, one of my first research studies that I did was looking, and this came from me as a nurse, working a 6-month rotation where I was on a straight night rotation.
Oh.
You see things at night in the hospital over and over again, and you see the pain points. So for my master's thesis, I basically did this study looking at, what happens if we were to offer patients earplugs at night so that they increase their quality and quantity of sleep in a very noisy acute care hospital. We don't have to give them a drug which has side effects, and somebody just needs to drown out the noise a little bit. Hey, do you know how much a pair of earplugs costs? It's minuscule compared to a drug, and the negative impacts or side effects, not there. So that's a very simple, tangible example of the types of pragmatic nursing research that can be done to say, hey, we can, take that 23 cents and give, and the quality of life and the healing that happens to patients when they actually get good quality of sleep.
Yeah.
So the big upside. So those are the kinds of interventions that we evaluate and amplify. I mean, there's a million other examples, but that's just a real simple one that I think everybody can appreciate.
That was a great example. Thank you for sharing that. So we're talking about, like the front line, like the individual nurse, like what they can do, but what from like a leadership perspective, like how can leadership support, nurses in doing this?
Yep. Come and take our Doctor of Nursing. Shameless plug. Anyway, I would say, educating themselves about, okay, what is innovation? What is the role of innovation in the health system, right? And so many times, and this is one of the things that saddens me about this whole idea of the term entrepreneurship. When people are in a large system like Alberta Health Services or another large health provider, they say, well, no, I'm not going to go start my own company. I'm not going to commercialize anything. And they're missing the point that this entrepreneurial thinking in healthcare shows up as what I would call intrapreneurship. How do we innovate from inside the system? And there's tons of opportunity for that, right? So, and I think from a leadership perspective, just understanding that innovation, expanding your mind, it doesn't have to be a thing. It doesn't have to be a randomized clinical trial, although it can be, and that's very important. But there's other opportunities for innovation that has huge bang for buck that are maybe right under your radar. And so talking to nurses and other frontline providers about what are the pain points, what are you seeing, what are the patterns that are frustrating you, and talking, making space to talk about what some of those answers might be. And there's, we're habitualized to think, we have these things like plan, do, study, act cycles, small cycles of rapid prototyping. We have these things that we can leverage, but in different non-traditional ways, right? That are going to yield different answers. And so I would say, looking at innovation from a policy perspective, what can we do to be innovative and entrepreneurially minded around the policies we set, right? And looking with that lens, or the systems flow, right? How are we setting up our operations? What is the workflow of, and you think about, things like just how our physical environment in healthcare sometimes shapes what we do, going back to nursing workarounds, right? Yeah. And thinking about, and looking at some of those things, that there's some low-hanging fruit that would probably add a lot of value and return on investment, and, decreased time, decreased pain and suffering, increased patient outcomes, satisfaction, nurse satisfaction. So look in unlikely places, and I would say above and all, be curious. If somebody is coming to you with a challenge or an opportunity, listening and being curious about what they're bringing, and finding that nugget that you can support. And I think that's the thing, we know in this day and age with healthcare, we've just come out of the pandemic, where budgets are always a concern. And sometimes I think senior leaders see innovation as one more thing they have to fund. And, that's not always the case. I think the idea that I would invite our senior leaders to think about is this idea of positive deviance. And what that means, and we have papers written about positive deviance in healthcare, but basically what that means, if you have, nursing team A and nursing team B, and they both have the same budget, and yet one unit has better outcomes, they have decreased lengths of stay, whatever outcome you want, right? They're doing better with the same budget that the other people down the road have.
Yep.
What are they doing? What's happening there that is they are having positive deviant, because not everybody else is doing this, obviously. So what is that secret sauce there? What's that inflection point that they've gotten onto, or that the patterns that they are doing that are adding value to the system? And paying attention to that and thinking about, okay, so then how can we spread that as a best practice, and then amplify those results?
I love this. So like curiosity, listening to your nurses. And I like that too, the thought of like innovation doesn't have to be that shiny thing.
No, and so many times we knee jerk to, it has to be this, shiny object and ooh, pretty.
Yeah.
It's not. It can be innovation, unfortunately can be very mundane, but it's the mundane, powerful innovation that goes overlooked.
Yeah. That's come from evidence that people have seen from the front lines. It's informed it. Yes, I love it.
And this is the whole thing. Sometimes what happens is there's this mantra of evidence-based practice, right? And from an innovation perspective, sometimes what happens is there's this noticing of patterns over time that are emerging that frontline clinicians will see. And I like to call it practice-based evidence instead of evidence-based practice, because it's putting those dots together like, oh my gosh, the last 5 patients that we've seen with diagnosis X, we did this and we haven't had them readmitted.
Yeah.
What's happening here? This is something that's emerging from our practice that has value, and how can we amplify that and research and study it so that it actually becomes evidence-based practice? But it's the yin and the yang practice banks. It's emerging from the grassroots, and then we legitimize it and scale and spread as evidence-based practice. But sometimes we miss those emerging practices.
Be sure to watch part 2 of this episode to catch the rest of my conversation with Sandra, where we discuss innovation in nursing education. To learn more about the Faculty of Nursing at the University of Calgary, visit nursing.ucalgary.ca. And to learn how to move your research to impact in the Innovation at UCalgary ecosystem, visit ucalgary.ca/innovation.